If you have health insurance, you know the drill. You don't pay the doctor or hospital, your insurance company does. Or do they? Patients who are struggling with their own medical bills may not even realize or care that sometimes their doctor or hospital is on the short end of the stick. But billing conflicts between insurance companies and doctors and hospitals are one reason healthcare costs in New York are spiraling out of control. That's when Kathleen Seyfried comes in to mediate disputes that often involve the strange language of medical codes. As a certified professional medical coder, Ms. Seyfried's expertise involves 5-digit numbers that represent every medical condition, diagnosis, and procedure.
As you can see from the books here, there are many, many codes. They go for hundreds of pages, and this is just the diagnoses. These are the services that the doctors can do for you. And so they need somebody who can identify all the proper components, for instance, of a surgical procedure or a simple x-ray. There is also training of the doctors involved in how to document these services. For instance, in the ER, you can have patients who come in with a simple cold up to a life-threatening emergency. A typical case might be a person with asthma. It's a very common disease, especially in certain areas of New York City. This could be any one of 3 or even 4 codes in the emergency department. How severe is the attack they're having? Is it mild? Is it severe? Is it so severe that the patient is now considered to be in a critical emergency and be a critical care visit that they would be choosing? The more severe and complicated, the more they have to document. They'll have to document a more complicated history. They'll have to document a more extensive examination. And the patient may be in a healthcare crisis that they are considered to be critically ill, and a critical care service needs to be documented. The higher the level of service, the higher the level of the reimbursement from the insurance company.
As with any codes, there can be misinterpretations and misunderstandings, which can result in delays and denials of payments.
There are policies and procedures that the insurance companies all have. It's not a standard policy and procedure that all insurance companies share. And so the medical necessity that supports reimbursement from an insurance company for one service may not support the reimbursement from another insurance. In addition, the insurance companies may want to deny a service because they say the services that you rendered and reported to us aren't supported by the medical necessity, the documentation doesn't warrant this higher level of service, in which case the doctor, according to the insurance companies, has overcoded. They then have to go to an appeal process, which takes time, and try to win on appeal that this service is warranted. Sometimes that needs to go to a second level. There are several levels of appeal, up to an administrative judge. Other times it's a problem that they're saying the insurance person isn't covered by the insurance on the date of service. That is much more problematic because now you don't have the patient with you. You don't have the patient's card. The card may have said they were eligible on that day. You may have gotten the eligibility confirmation, but retroactively they were disenrolled from that insurance, changed to another, and you don't have a way to get that information very easily. So it's very time consuming, and it's a lot of phone calls and a lot of letters going out to patients. What I try to do with the doctors is train them on a proper documentation of medical necessity. With the denials, we try to look at what are the common reasons for the denials, see if there's something we can put in place at the front desk office, getting a copy of the insurance card, making sure that somebody on the day of service did call the insurance company and make sure the service was authorized and the patient was eligible for that insurance on that day. But even with those things, there can still be a denial.
We asked both Ms. Gross and Ms. Seyfried what, from their unique points of view, the main problems of the current healthcare systems are, and what might be done to correct them.
When you call an 800 number to speak to the insurance company, you go one step to the next step to the next step, just dealing with the computer. It's very difficult to get an individual on the phone to discuss the issues.
Let's have the insurance companies live up to their policies and procedures. If something was authorized, if you got that acknowledgement before the service was rendered, use that and acknowledge it. I would have these claims be reimbursed similar to what you have right now with an ATM or a credit card inquiry. You render a service today, you bill it, and you get that reimbursement right away.
A lot of the insurance companies are on the stock market. So when they are making a profit, that money goes to the stockholders for them to be able to get more money in their own pockets.
The biggest problem with waste in the billing of insurance companies for reimbursement of services rendered has to do with the vast number of denials. Whether it's a problem at the doctor's office or more commonly a problem with the insurance company putting in roadblocks. You need to have an authorization, but you have the authorization. You submitted it. They kind of ignored that. You have the medical necessity, but they're saying, no, it doesn't meet our requirements.
In a lot of situations, they have them keep on sending in claims over and over again.
This is a game that's being played. The more time they have to keep their money, the premiums that the patients pay and the companies pay for the insurance coverage, the longer they hold on to that, the longer they have to earn interest on it for it to stay in their own pockets.
I feel that all insurance companies, when it comes to health insurance should always be nonprofit.
Definitely issues to think about as we move towards a healthcare system where almost everyone will be required to buy health insurance.